that is the laryngeal inlet. Look here. This hole is the part of larynx, and above this is the oropharynx, and behind this is the laryngopharynx. Just above the larynx, you are seeing this interpreted line. This interpreted line is inlet of the larynx. Inlet of the larynx. Okay. Now, the larynx, it is a windpipe of the lower respiratory tract. Now, the lower respiratory tract, that is the part downward, and this larynx is continued downward into the part of trachea, and trachea dividing into and entering into the lungs, where it again division taking place, continued into the bronchioles, bronchi, bronchioles, then alveoli, alveolar ducts, all these. So starting from trachea to the alveolar sac, that whole part comes in the lower part of respiratory tract. So lower part of respiratory tract, including the trachea, the part of bronchi, bronchioles, alveoli, alveolar sac, all these are the part of lower part of the respiratory tract. The upper part of respiratory tract, including the nasal cavity, nasopharynx, so that is the upper part of respiratory tract. Larynx is a windpipe structure lying above. It is continued into the upper respiratory tract, and lower down it is continued into the lower respiratory tract. As this is lying between the upper part of respiratory tract and lower part of respiratory tract, it also helps in the respiration. Very simple thing. The windpipe structure, that is this one, above it is continued into the part of upper respiratory tract. Lower down it is continued into the part of lower respiratory tract. And above, where it is continued into the part of oropharynx and this, there is present the inlet of larynx. And posteriorly, there is also present laryngopharynx. So, this windpipe structure, we can say also that if we start from lower part of respiratory tract, it is slightly upper dilated part. Look here, trachea is not so dilated. Just above the trachea, the dilated part is the part of larynx. And this larynx is having the very important functions. The functions of the larynx including phonation of sound. That means it is the organ which produces this sound. First, very important function. Second, it also helps in respiration, as it is lying between the upper and lower part of respiratory tract. So it also helps in the respiration. Second, it also helps in deglutition. Whenever we take any food or drink water or whatever, there is the movement of the larynx, upward and downward. And that upward and downward movement of the larynx helps in the deglutition. Besides this, it also acts as a sphincter. It protects the lower respiratory tract from the entry of foreign particles or liquids or food. So it acts as a sphincter which doesn't allow the liquid or food particles or anything inside the lower respiratory tract. So these are the four functions of the larynx. Important, phonation of sound. Second, it helps in the part of respiration. Third, in deglutition. And fourth, act as a protective or act as a sphincter which helps in the before entering of any foreign particles inside the lower respiratory tract. So, this windpipe structure, how it remains intact. So, when we mention about the larynx, it is a skeletal framework, and that skeletal framework is consisting of number of cartilages. Anteriorly, you can see the thyroid cartilage. Posterior to the thyroid cartilage, below the thyroid cartilage, another cartilages are present. Below the thyroid cartilage, cricoid cartilage, posteriorly arytenoid cartilage, cuneiform cartilage, corniculate cartilages. So, point is this, that number of cartilages are present, and these cartilages, they are interconnected with each other. ऐसे तो रुकेगी नहीं. So they are interconnected by number of the ligaments, and not only the ligaments but also the membrane. So these cartilages, which are interconnected with each other by number of the ligaments, number of the membranes. Besides this, there is also attached the muscles, and these muscles help in the movement of the laryngeal cartilages. So that is the skeletal framework. And this skeletal framework, let's see what are the cartilages. First of all, look this part. I want to tell you because I will use the word inlet of larynx. Look this part. This is the base of the tongue. From the base of the tongue, you can see this is the part of epiglottis. Epiglottis is attached with the posterior surface of the tongue by the ligaments. The median ligaments, that is called median glossoepiglottic ligaments. That means the ligament between the posterior surface of tongue and epiglottis. Look here. This is the epiglottis and this is the tongue. So ligament one is the median glossoepiglottic ligament. And just lateral to this, there is present the lateral glossoepiglottic ligament. Between these two ligaments, one, look, this is the median ligament, this is the lateral glossoepiglottic ligament. The space present on both the sides of median glossoepiglottic ligament, those spaces are called vallicula. Those spaces are called vallicula. So what is the vallicula? That is the space present on both the sides of median glossoepiglottic ligament. If you want to see, stand opposite the mirror, open your mouth and see. Uvula is above and downward, but on the posterior surface, very difficult to see until unless we use the laryngopharynx. Only opposite the mirror you can see the uvula and the posterior part of the tongue, but more accurately it is seen by the laryngoscopy. Okay, don't forget. Now look here. This is the part epiglottis. Okay. Now look here downward. This is the laryngeal inlet. I am talking of this laryngeal inlet. And downward, you can see these are the aryepiglottic fold, which you are seeing here like this. Both the sides. Aryepiglottic fold, that means it is connected. These are the cartilages. Arytenoid cartilage. So the fold starting from arytenoid cartilage and attached to the lateral margin of the epiglottis. Epiglottis just like a leaf-like structure. It is just a leaf-like structure. So the mucous fold coming from arytenoid cartilage attached to the lateral side of the epiglottis. That is called aryepiglottic fold. So the one of the margin is formed by the aryepiglottic fold. And look downward, posterior surface. Here, this is the arytenoid cartilage, another arytenoid cartilage. Two arytenoid cartilages, they are connected with each other by the mucous membrane. That is forming the posterior boundary of inlet of the larynx. I will use this word inlet of larynx, so have an idea what is the inlet of larynx. Inlet of larynx, anteriorly it is bounded by epiglottis. Anteriorly it is bounded by epiglottis. Posteriorly it is bounded by aryepiglottic fold, and posterior most, that is the interarytenoid fold. Interarytenoid fold, that is this one, posterior most. on posterolateral side by aryepiglottic fold, anteriorly by epiglottis. That is inlet of the larynx. After seeing this, come to the different cartilages of the larynx. Look here. The larynx is consisting of number of the cartilages, and these cartilages, we divide these into paired cartilages, unpaired cartilages. Unpaired cartilages which are present in the larynx, one is the thyroid cartilage. This one, that is unpaired. Below the thyroid cartilage, there is present the cricoid cartilage. I will show in the next, which you can see this one, the lateral side of the cricoid cartilage. The cricoid cartilage is complete one, single, and it surrounds the complete part of the laryngeal cavity. Cricoid cartilage, this is the thyroid cartilage, and below the thyroid cartilage, the anterior arch of the cricoid cartilage is thin, while the posterior part of the cricoid cartilage is larger, lamini. So, below this, these are the two, and another unpaired cartilage is epiglottis. So, these are the three cartilages of larynx which are unpaired: epiglottis, thyroid cartilage, and cricoid cartilage. Besides this, there is also present the pair of cartilages. The cartilages which are present in pair, and these are the parts. Look downward, arytenoid cartilage, pyramidal shape. One is arytenoid cartilage which is present in the pair, and the part now look this part. I am talking of these. This is the thyroid cartilage. Below the thyroid cartilage, this is the cricoid cartilage, anterior arch of the cricoid cartilage. And look the posterior part. This is the epiglottis anteriorly. And posteriorly, if you see the epiglottis leaf-like structure, the narrow part below, that is called stalk of the epiglottis. Okay, below this, lower down, see, just posterior to the thyroid cartilage, you can see the pyramidal shape. That is the part of arytenoid cartilage. Just above the arytenoid cartilage, pin shape, very small, the corniculate cartilage, and above the corniculate cartilage, there is the part of cuneiform. All these are the cartilages which are present in pairs. So, paired cartilages are all these. Now, the important one I will talk separately. Look the thyroid cartilage first. The thyroid cartilage, it is acting as a shield, protect the larynx, and it is having the two lamini. You can see the two lamini of the thyroid cartilage, they are fused in the midline. They are fused in the midline, and the fusion of these are forming the angle of the thyroid cartilage. And this angle of the thyroid cartilage, it is about 90 degree in male and obtuse in female. Before the puberty, listen very carefully. Before the puberty, the boys, male boys and female boys are almost same. But after the puberty, there is thyroid cartilage becomes more aggressive, more prominent, and this prominent part is called Adam's apple in male. And this is the reason, madam, या तो बाहर चल जाओ आप, मेरे को बार बार डिस्टर्ब मत करो. I don't want to see your face again. There is nothing to smile. Listen, this Adam's apple is responsible for high loud voice. So in male, the voice is loud, but the pitch of the voice is low. I will ask, and if you will not reply, what is the reason why the pitch is low? Because Adam's apple resulting in the loudness of the voice. In male, the voice is loud and pitch of voice is low. Opposite to this, in female, the pitch of voice is high, and also in the children's, the pitch of voice is high compared to the male. The loudness is low. The loudness of voice is low in female and pitch is high. All right. Let's see. The posterior border of the thyroid cartilage, that is this one. The posterior border of the thyroid cartilage projecting upwards and downwards, and these are called superior cornu and inferior cornu of the thyroid cartilage. These are called superior cornu and inferior cornu of the thyroid cartilage. Now, the posterior surface of thyroid cartilage is giving attachment to the number of the structures. Look above. The leaf-shaped structure, that is epiglottis. Epiglottis lower end is narrow and it is attached with the posterior surface of thyroid cartilage by the ligament, and that ligament is called thyroepiglottic ligament. I am talking of this. This narrow end of the epiglottis is called stalk. So that is the stalk of the epiglottis is articulated with the posterior surface of thyroid cartilage by the ligament, that is thyroepiglottic ligament. Just below the thyroepiglottic ligament, you are seeing the another ligaments. These are the vestibular ligaments. Vestibular ligament. And below the vestibular ligaments, there is also the vocal ligaments. So pair of the vocal ligaments, above that the pair of vestibular ligaments, and above that thyroepiglottic ligament. If we go to lateral side of the vocal ligaments, there is attachment of the muscle. These are the vocalis muscle and more laterally thyroarytenoid muscle. All these structures, they are present on the posterior part of the thyroid cartilage. Not only this, look this part. This is the lateral side of the thyroid cartilage. On the lateral side of the thyroid cartilage, have you gone through the thyroid bone, thyroid cartilage? Not yet. During the section? Not. क्या करते हो? You have done the thyroid gland? तब तो आना चाहिए ना. On the lateral side of the thyroid cartilage, there is oblique line, and this oblique line is giving attachment to the muscle. There is origin of the two muscles, thyroarytenoid. Thyroid is anteriormost and posterior is thyropharyngeus. These two muscles, red color shown, are taking the origin. While there is interpreted line showing this one, that is the sternothyroid, which is inserting over this thyroid cartilage. The posterior border of the thyroid cartilage, look this one. It is giving insertion to the three muscles, palatopharyngeus, salpingopharyngeus, and stylopharyngeus. All these three muscles, they are inserted on the posterior border of the thyroid cartilage. So all these are the three structures which are attached to the thyroid cartilage. Now look the one more. These are the, what are these? Have you seen the trachea? There is present the tracheal rings. So these are the tracheal rings. I am talking of this one. And above the first tracheal ring, there is also the anterior arch of cricoid cartilage. The posterior part of the cricoid cartilage you can see here, that is higher, while the anterior arch is narrow. So from the upper border or anterior part of the upper border of the cricoid cartilage or upper arch of the cricoid cartilage, a muscle take origin, and this muscle is inserted above to the inferior cornu of the thyroid cartilage and the lower border of the thyroid cartilage. This muscle is the very important muscle, cricothyroid. The cricothyroid muscle is one of the muscles which tense the vocal cords. Vocal cords tense. Before production of the sound, the vocal cords tense, so they can vibrate when we take the air. And by the vibration of the vocal cords, sound is produced. So, tensing of the vocal cords is very important for the production of the sound. And vocal cords is tensed by the two muscles. One is the cricothyroid and another is vocalis muscle, that is the intrinsic muscle of the larynx. Alright. After seeing this, look the posterior part of the cricoid cartilage. That one, this one. The posterior part of the cricoid cartilage is higher, consisting of the laminae, which is higher. And this posterior surface of the cricoid cartilage is just in the middle, that is the esophagus tendon relation. On each side of this, there is important muscle, posterior cricoarytenoid muscle. That is the safety muscle of the larynx. Posterior cricoarytenoid muscle is the safety muscle of the larynx, lichlo, because this is the only muscle of the larynx which abduct the vocal cords. Posterior cricoarytenoid muscle is named as safety muscle of the larynx. Why? Because this is the only muscle of the larynx which abduct the vocal cords. Otherwise, all the muscles of the larynx are adductor of the vocal cords. If the vocal cords abduct नहीं होगी तो patient मर जाएगा. Because of this is called safety muscle of the larynx, because it abducts the vocal cords. Besides this, all the other muscles of the larynx are adductor of the vocal cords. After seeing this, we come to the another part. As I told you previously, that larynx is consisting of number of the ligaments and membrane and muscles. So we will talk one by one. From look anterior side, look this diagram. This is the thyroid cartilage, no problem. Above that, looking, this is the hyoid bone. दिख रही है आपको? At present, forget this epiglottis. That is lying posterior to this. And below the thyroid cartilage, look here, that is the part of cricoid cartilage, this one. And lower down, these are the tracheal rings. The membrane which is connecting the hyoid bone above, thyroid cartilage below, this is called thyroid membrane. Thyroid membrane is pierced by which nerve? Internal laryngeal nerve. Okay? So thyroid membrane is the one that is connecting the hyoid bone above and thyroid cartilage below. Okay, no problem. This thyroid membrane, which is thickened in the center, दिख रहा है आपको? It is thickened in the center. This thickening of the thyroid membrane in the center is called thyroid ligament. So this is the thyroid ligament. Thickening of the thyroid membrane in the middle, that is called thyroid ligament. Next to this, on the lateral side, again the thickening of the thyroid membrane, that is called lateral thyroid ligament. So these are the lateral thyroid ligament. Lower down, look, this is the cricoid cartilage. Above, this is the thyroid cartilage. A membrane extends between the two, that is called cricothyroid membrane. Cricothyroid membrane. And this cricothyroid membrane is again thickened in the center, that is called cricothyroid ligament. This one. This is the cricothyroid ligament. After this, lower down, this is the cricoid cartilage and this is the tracheal ring. These are also articulating with the ligaments. That is called cricotracheal ligament. So I am talking of this cricotracheal ligament. So these are the membranes present on the anterior surface and ligaments. Now look the posterior surface. On the posterior surface, there is also present the different ligaments that I have told you previously in the posterior surface of the thyroid cartilage. You want to see again? Buccal ligament. Look here. Thyroepiglottic ligament, the vestibular ligaments, buccal ligaments, all these are present on the posterior surface of the thyroid cartilage or interior of the laryngeal cavity. Besides the ligament which I told you on the posterior surface of thyroid cartilage, there are the few ligaments which are present on the interior side. This is the head bone. Just from the upper and posterior surface of the head bone to the epiglottis. This is the epiglottis. There is a ligament. This is called hyoepiglottic ligament. Hyoepiglottic ligament. And downward, this is the thyroid cartilage and this is the epiglottis. So we have already discussed this is the thyroepiglottic ligament, this one. And this whole is the thyroid membrane. Besides this, and exterior we have seen there are the two membranes. One is the thyroid membrane, another is cricothyroid membrane. On the inner side of the larynx, again there are the two important membranes. These are, the upper one is quadrate membrane, this one. This is the quadrate membrane, and lower down this is the cricoid cartilage, and again this is the part of thyroid cartilage. So this is membrane is called cricobuccal membrane. Now these membranes are important because their lower border of the quadrate membrane is from the vestibular ligament, and the upper border of the cricobuccal membrane is forming the buccal ligaments. So let's see before the attachment of the two membranes. The quadrate membrane, before the attachment, look, this is the arytenoid cartilage. The arytenoid cartilage is pyramidal in shape, and this pyramidal shape, this is the apex of the arytenoid cartilage. Above the apex of arytenoid cartilage, you are seeing the very nodules. This is the corniculate cartilage, and above the corniculate, this is the cuneiform cartilage. These are paired cartilages. Very simplified. Don't be so anxious. Now look the attachment of the membrane. The quadrate membrane, it is attached to the lateral side of the epiglottis. This is the epiglottis. From the lateral margin of the epiglottis, this membrane comes, and posteriorly it is attached to the part of the lateral side of the arytenoid cartilage, this one, and above to the corniculate and cuneiform cartilage, and anteriorly it is attached to the posterior surface of thyroid cartilage, that is this one. So this is the whole attachment of the quadrate membrane. The lower end of the quadrate membrane, I am talking of this. The lower end of the quadrate membrane is free, and this lower end which is free is forming the vestibular ligament of the larynx. The mucous membrane is covering this vestibular ligament, that is called the fold of the vestibular fold of the larynx. Okay. The important one, look the downward. The membrane which is extending from the complete upper border of the cricoid cartilage. This is the cricoid cartilage attached along the upper border of the cricoid cartilage and extending attached to the posterior surface of the thyroid cartilage. This cricobuccal membrane, the upper end of the cricobuccal membrane is free, and this free upper end of the cricovocal membrane is forming the vocal ligaments. Vocal ligaments are also covered by the mucous membrane and forming the vocal fold. The vocal fold are the important which are producing the sound. The movement of the vocal folds is very important. They are forming the sound. Another point, sometimes the teacher is not sufficient here. They ask, what is the difference between vestibular ligaments and vocal ligaments? The vocal ligaments are yellow elastic cartilage, yellow elastic ligaments, while the vestibular ligaments, they are white fibro cartilage. All right. See one more thing here. There is a space existing between the two ligaments. I am talking of this empty space. This is called sinus of larynx. Sinus of larynx. That is a space existing between vocal ligaments above, the vestibular ligaments above and vocal ligaments below. That space is called sinus of larynx. After talking of the various membranes and ligaments, let's see the muscles of larynx. The extrinsic muscles of the larynx we have already discussed. The palatopharyngeus, salpingopharyngeus, and also the cricothyroid. All these are the muscles of larynx which are present outside. The function of extrinsic muscles of the larynx is to elevate the larynx. बहुत ध्यान से सुनिए. There is two group of the muscles. One is the extrinsic muscles of the larynx and another is intrinsic muscles of the larynx. Extrinsic muscles of the larynx, they help in the elevate of the larynx. While there is the one muscle which depress the larynx, which is coming from the sternum to the thyroid cartilage, that is sternothyroid. So sternothyroid is the muscle which depress the larynx, only one muscle. Otherwise, all the extrinsic muscles, they elevate the larynx. Then let's see the intrinsic muscles of the larynx. The function of the intrinsic muscles of the larynx. Extrinsic muscles का function तो हमें पता है. They either elevate the larynx or depress the larynx. While the intrinsic muscles of the larynx is having the different functions. And these functions is the muscles which are opening and closing the inlet of larynx. A group of muscles which open and close the inlet of the larynx. The muscles which open the inlet of larynx are, look here, this is the arytenoid cartilage, this is the epiglottis, epiglottic muscle. This long muscle, epiglottic muscle, you can see here also, epiglottic muscles, and continued this epiglottic muscle, there is oblique arytenoid muscles. So these two muscles, epiglottic muscles and oblique arytenoid muscles, they close the inlet of larynx. They close the inlet of larynx. And the muscle, just look here, this is the thyroepiglottic muscle. The thyroepiglottic muscles open the inlet of larynx. The closing of inlet of larynx is required when we take the food, eat the food or drinking water or any liquids. The thoracic inlet must be closed. Because if it is not closed, then the liquid or the food particles can enter into the larynx. And once they enter into the larynx, they product the protective cough is stimulated. And there is explosive coughing. The purpose of explosive cough is to expel out the liquid or the food particles which enter into the larynx. That is called protective cuff reflex. बहुत सीधी बात बताइए आप पानी पीते हैं या कुछ भी लिक्विड लेते हैं या खाना खाते हैं, कुछ पार्टिकल्स अगर लैरिंग्स में चल जाता है तो लैरिंग्स स्टिमुलेट द प्रोटेक्टिव कफ रिफ्लेक्स, द पर्सन इमीडिएटली कफिंग very large explosive. So why this protective cuff takes place? To expel out the liquid or the particles of the food which enter into the larynx. If it is failed, protective cuff reflex is failed, then person will create another problems. Okay. So the muscle which close the inlet of larynx are two, aryepiglottic and oblique carotenoid. These are the two muscles which close the inlet of larynx, while the thyroepiglottic muscle which open the larynx, inlet of the larynx. Next to this, there are the muscles. As I told you previously, the abductor of vocal cords is only the one muscle, that is posterior cricoarytenoid, and that is also called the safety muscles of the larynx. अगर vocal cords abduct नहीं होगी तो person cannot inspire the air. Understand? And besides this, the other intrinsic muscles of the larynx are adductor of the vocal cords. Then the muscle of the larynx which is responsible for tensioning the vocal cords. The muscles which tense the vocal cords are two, cricothyroid and vocalist muscle. Cricothyroid muscle and vocalist muscle, these are the two muscles which tense the vocal cords, and tensing of the vocal cords is important to produce the sound. When we inspire the air, that air forces the tense vocal cords. As the air comes over the tense vocal cords, the vocal cords vibrate. Due to vibration of the vocal cords, sound is produced. So these are the functions of the intrinsic muscles of the larynx. Now see the part you can see that is this is the vocalist muscle and this is the cricothyroid muscles. Both these muscles, they are tensing the vocal cords. Now we divide this larynx into three parts. The larynx is dividing into three parts, and look this diagram to understand this part. Above there is the thoracic, the laryngeal inlet, that is this part. So you can say that larynx is the part which is extending from inlet of the larynx above downward to the upper part or the lower part of the cricoid cartilage. The cricoid cartilage, it is lying at the level of C6 vertebra. So the interior part of we divide the laryngeal cavity into three parts. For the division, before the division, see these two parts. In the upper parts, there is the part vestibular fold, this one, and downward there is the vocal folds. The space between these two, that is called sinus of larynx. So as it is lying between the two folds, above the vestibular fold, downward is the vocal fold. So this space is also called glottic part of the larynx, glottic part of the larynx or sinus of the larynx, that is middle one. Above the glottic or the sinus of the larynx, this is called the supraglottic part of the laryngeal cavity, supraglottic part of the laryngeal cavity, and downward this is the infraglottic part of laryngeal cavity. The supraglottic part of larynx, that is this one, it is very sensitive. Supraglottic part of the larynx is very sensitive. Any foreign particles, maybe the liquid or the food particles, if they comes in the supraglottic part, it is stimulated because it is very sensitive. Now, what is the nerve supply supraglottic part? Internal laryngeal nerve. So thyroid membrane is pierced by internal laryngeal nerve, and that internal laryngeal nerve is supplying sensory part above the vocal cords, and below the vocal cords it is supplied by recurrent laryngeal nerve. I told you very clearly that remember this thing, always asked. So the supraglottic part of the laryngeal cavity is very sensitive. Whenever anything, foreign liquid or the food particles enter into the larynx, it stimulates and provides the protective cuff reflex. Provide the protective cuff reflex to expel out that part. The sinus of the larynx, that is this part. Look the glottic part or sinus of the larynx. On lateral side of the sinus of larynx, there is a saccule or just dilated part. This dilated part, I am talking of this. This is saccule. You can see here the saccule also. Saccule is the part which is consisting of mucus glands, secreting the mucus secretion, and that mucus secretion is covering the vocal folds. In sinus itself, there is no gland. Sinus of larynx is having no glands, and vocal cords are continuously vibrate, so their epithelium should be disturbed or damaged. To protect the epithelium, the mucus fluid coming from the saccule, and they lubricate the vocal cords. That is the purpose of the saccule. So on each side of the sinus of the larynx, there is a mucus secreting gland, and that is called the saccule of the larynx. The saccule of larynx is not so high as shown here, but this saccule of larynx is becoming more dilated in the person trumpet players, which is very common nowadays. हर जगह सीरियस हो जाते हो, बैंड वालों को नहीं देखो, they are the trumpet players. So in trumpet players, the saccule is very much large, and also in the teachers, the saccule may be large. As we go down, this is the infraglottic part of the larynx. The infraglottic part of the larynx is supplied by sensory supply of this is by recurrent laryngeal nerve. At this part, look here, I hope you have done. Look the supraglottic part. The supraglottic part, laterally it is formed by the airy epiglottic fold. This is the airy epiglottic fold. And this is the part, you can see the another membrane on this side. And this is the thyroid membrane, green color, and the space existing between the airy epiglottic fold and the another membrane, or the lateral side, on the lateral side of the supraglottic part, there is a fossa. This fossa is called piriform fossa. You have not done in the pharynx, piriform fossa. on lateral side of the supraglottic compartment. This is the supraglottic compartment. On the lateral side of the supraglottic compartment, this is the piriform fossa. This piriform fossa normally the person is not aware, but for a doctor it is very important, and also for the girls. The reason is boys, they can take the pin or safety pin that may lodged in the piriform fossa. That is the reason why the parents are don't allowed to take the young and very small boys to take the safety pin in their hands. Because if they take the safety pin in the mouth, that safety pin can lying in the piriform fossa. Or the person who have taken the alcohol, or they are not immediately, they after taking the food immediately they don't digest it completely, the food can held in the piriform fossa. Or if you are taking the fish particles can also lodge in the piriform fossa, and the person come immediately to the doctor. Because once they come here in the piriform fossa, the person feels difficulty in the breathing and this part, and the doctor is to take out that foreign particles, whatever it is. But one thing keep in your mind, while taking out the foreign particles from the piriform fossa, you should be careful. Don't touch or don't rub the piriform fossa inferiorly, because in the inferior part of the piriform fossa there is internal laryngeal nerve. If we will damage the internal laryngeal nerve by taking out the foreign particles, what will be the condition? The protective cuff reflex will be absent. My dear, very simple thing I am telling you. Whenever we take out the foreign particles from this piriform fossa, in the floor of piriform fossa is lying internal laryngeal nerve. If we scratch downwards the piriform fossa floor को scratch कर रहे हैं, निकाल रहे हो बाहर, if more scratching, that will damage the internal laryngeal nerve. If the internal laryngeal nerve will be damaged, the protective cuff reflex will be absent. And protective cuff reflex is absent, the person can take the liquid or part of the food, inhale inside the larynx. After knowing this, let's see the nerve supply of the larynx. The larynx, muscles of the larynx, all the muscles of the larynx, they are supplied by the recurrent laryngeal nerve. All the muscles of the larynx are supplied by recurrent laryngeal nerve except the cricothyroid. That is supplied by external laryngeal nerve. Okay, very simple. Let's see the cricothyroid muscle again. I want to tell you one thing here, because at present we are knowing the larynx. The vagus nerve is giving the superior laryngeal nerve, which is again dividing just at the posterior border of the middle constrictor muscles into internal laryngeal nerve and external laryngeal nerve. Internal laryngeal nerve pierces the thyroid membrane. Alright. Recurrent laryngeal nerve descending down, and it enters into the thyroid cartilage because it is supplying to the intrinsic muscles of the larynx. So it must enter in the thyroid cartilage. So how it enters into the thyroid cartilage? It runs along the inferior border of the thyroid cartilage. It runs along the inferior border of the thyroid cartilage. Lying along the inferior border of the thyroid cartilage, there is present the branches of inferior thyroid artery. Listen carefully, because once you will do the partial thyroidectomy, very common. When the surgeon is doing the partial thyroidectomy, that means partially remove the thyroid gland. Nowadays very common. When the person becomes heavy, they go to the doctor and thyroid is not working properly and like that. So when doing the partial thyroidectomy, keep this thing in your mind that ligate the inferior thyroid artery away from the thyroid cartilage. Inferior thyroid artery, जब भी कोई आप चीज को डिसेक्ट करेंगे तो ब्लड वेसल्स को लाइगेट करते हैं. So in partial thyroidectomy, ligate the inferior thyroid artery away from the thyroid cartilage. The reason is because the recurrent laryngeal nerve enters the thyroid cartilage, enters the larynx below the lower border of the thyroid cartilage along these branches of the inferior thyroid artery, and then it is piercing or lying deep to the inferior thyroid ligament and enters into the laryngeal cavity. And this way of entering of the recurrent laryngeal nerve into the thyroid cartilage is also named as inferior laryngeal nerve. So keep this thing in your mind. If the question asks you, the vagus nerve giving the superior laryngeal nerve, is there any inferior laryngeal nerve? Yes. The entry of the recurrent laryngeal nerve inside the larynx is called inferior laryngeal nerve. Okay. So if the question asked in MCQ, you have to reply. That is the entry of the recurrent laryngeal nerve inside the larynx. That is called inferior laryngeal nerve. Now look this diagram. When there is inlet of the larynx is closed, whatever the cause, maybe the entry of the food particles or the liquids or what. When the inlet of the larynx is closed and you are doctor, so what you will do? You will expel out that foreign particles, whatever it is. For expelling the foreign particles, look this diagram. Stand behind the patient and take your two hands. One hand should be fist and another is like this, and put this at the epigastrium region. By putting at the epigastrium region, then thrust upward and backward like this. So by doing this, this movement is continuous, and by doing this what happens? That the air present in the lungs is expelled or squeezed out. This air which is present in the lungs is squeezed out, comes into the part of trachea, then in the larynx. As it comes with pressure in the larynx, it will dislodge that foreign particle, and that foreign particle will comes out, and you can see the light. Okay, so that is the part which is done to expel the foreign particles which enter into the larynx, and this procedure is called Helmich procedure, who was done first time. Now look this part. the singers or the teachers who are using more frequently the vibration of the vocal cords. On the medial side of the vocal cords, there is swelling is formed. I am talking of this. This is called vocal nodules. When the vocal nodules are present, if the person is singer, he or she feels difficulty in the voice of the sound. And that is the same thing in the teachers. This, the important part of the larynx. If you want to visualize the larynx, the procedure is called laryngoscopy. Laryngoscopy. Laryngoscope is an instrument which is put in patient and to visualize the complete part of the larynx. You can visualize all the ligaments, all the mucous membrane or the sinus of the larynx by the laryngoscope, and the method is called laryngoscopy. This is the picture when we do the laryngoscopy, how we see the structure. Look here, this is the part of inner surface of the trachea, and these are the vocal cords. You are seeing these are the vocal cords. The space between the vocal cords, that is called the rima glottis. So rima glottis is the space. Look here, this is the one vocal cord, this is another vocal cord. The space between the two vocal cords, that is called rima glottis. And the space between the two vestibular folds, that is called rima vestibuli. At present, should see this, then I will tell you another. So this is the vocal cords. Innermost is the vocal cords, and the space between the two vocal cords, that is rima glottis. Just lateral to the vocal cords, this is the vestibular fold. This is the vestibular fold, and look here, you are seeing this is the aryepiglottic fold. ये दिख रहा है आपको? This is the aryepiglottic fold, and this is the epiglottis. And downward, this is the cuneiform cartilage, and this is the corniculate cartilage. So look, the two corniculate cartilage are articulating by the mucous membrane, that is interarytenoid fold, that I have told you. Posteriorly, the inlet of the larynx is formed. The posterior boundary of the inlet of larynx is formed by the interarytenoid fold, and laterally it is by the aryepiglottic fold. That is this one. And look here, this is the piriform fossa. So this is the view when we see by the laryngoscope. So that is all about the larynx. One more thing I want to tell you, because I didn't tell you by the time of vagus nerve. If I will see such condition of the faces, I can stop. Why don't you serious during the class? Yes, girl, get up. Get up. Bilkul, immediately. What is the nerve supply of infraglottic part of the larynx? Sensory nerve supply. Tell me. For what purpose you are sitting here? You have wasted your 1 hour. Don't come in class. See the condition. That's why I don't like continuously you were talking. You can't reply the simple thing. What is the nerve supply of sensory nerve supply of infraglottic part of larynx? Sit down. In facial nerve, I told you that, no, but in the vagus nerve, come in the vagus nerve, the superior ganglion and inferior ganglion. Superior ganglion is giving the two branches. One is the meningeal branch, another is auricular branch of vagus nerve. The auricular branch of vagus nerve, that is here, and it is also combined, it is also joined with the auricular branch of the facial nerve. Okay, this is supplying to the tympanic membrane and all that part. So being a ENT specialist, you may face, commonly the patient comes, sir, I have wax in my ear. Okay, so what we, being a doctor, what we do the syringing. पेशेंट आता है, पेशेंट कहता है साहब वैक्स आ रही है, काफी वैक्स इकट्ठी हो गई, तो आप क्या करेंगे? यू विल डू द सिरिंजिंग टू एक्सपेल आउट द वैक्स, बट keep one thing in your mind, don't do the syringing forcefully, don't do the syringing forcefully, do the syringing very lightly, very slow. The reason is because if you do the syringing forcefully, the vagus nerve can stimulate. Vagus nerve can stimulate, and the stimulation of the vagus nerve can cause vagal syncope. Patient will die. Why? The forceful syringing stimulates the vagus nerve. Stimulation of the vagus nerve resulting into the vagal syncope. And what is the vagal syncope? The stimulation of the vagus nerve decreases the heart rate and blood pressure. Sympathetic stimulation increase the heart rate and normal. And stimulation of the vagus nerve resulting into the vagal syncope. What is the vagal syncope? Decrease the heart rate and the person will, increase the heart rate and person will die. So be careful doing syringing. Never do the syringing forcefully. This is not so, but you should keep in your mind, being a very important thing